Hello guys, Dr. Qureshi here, and today's video is going to be on different terminologies because patients have asked me to make the video on these conditions because they feel like they need to know the terms in a better way, and they asked me to explain these terms because I get to see these things on a regular basis in private practices. So I have a little cheat sheet with me today on a sticky note. I'll show it to you quickly. There you go. So I have this with me, so I'm going to make sure that I'm covering majority of the things here. Okay, so the first one is, yes, so they come in with twitching of the eyelids, and they asked me to talk about that. So commonly, if it's one eye twitching, and it's very annoying actually because it seems like people can see it, but you can feel it, like one eyelid is twitching. That condition is known as myokymia. And the causes for that is three main causes. So it's either lack of sleep or too much stress or too much intake of caffeine. So that is myokymia. So if you decrease your stress levels, start getting quality sleep, and also decrease your caffeine intake, then I have noticed in my case also, like sometimes I get this twitching, irritating twitching. It's very annoying. It goes away when I decrease my caffeine intake, definitely. So remember, too much stress, too much caffeine, and lack of sleep can cause that twitching unilaterally, which means one eye. Then the second condition is when both eyes are twitching. That is blepharospasm. So that's a different condition. Then they asked me to talk about subconjunctival hemorrhage, and subconjunctival hemorrhage, I think I made a video on that previously also, where I showed you a case where this patient came to me with the redness in the white part in the subconjunctival area. She had that because she had had an incident where she had fallen on the ground during winter season. I think she slipped on the ice or something. And then she hurt her arm, had a fracture, had to go to the ER, and ended up having a subconjunctival hemorrhage. I think I forgot to mention in that video the causes for subconjunctival hemorrhage. So either if you're taking blood thinners, because if you're taking blood thinners, they can cause that bleeding to happen in the subconjunctival area. And remember, conjunctiva is the white part. In layman's terms, I always like to explain it in simpler ways to my patients and to my audience. So that would be the subconjunctival hemorrhage if you are taking a lot of blood thinners, or if you are coughing excessively. So excessive coughing, not just like coughing here and there occasionally, but like a lot of excessive coughing. Because remember, it has to be your intrathoracic pressure, so in the thorax area, has to be more. Anything that goes above, like higher pressure in the intrathoracic area, is going to cause this subconjunctival hemorrhage. So higher pressures in the intrathoracic area is going to cause subconjunctival hemorrhage. Too much of constipation can lead to that also. And I have noticed heavy lifting. If you're lifting heavy weights, again, the pressure increases, and that can lead to subconjunctival hemorrhage also. Then trichiasis is another terminology that my patients ask me to explain because sometimes patients come in with ingrown eyelashes. So instead of the eyelashes going up like this, they have the eyelashes growing inwards, and then they start touching the cornea, scratching the cornea, irritating the cornea, leading to dry eyes, leading to inflammations, leading to superficial punctate keratitis. So what do we do for that? The easiest treatment is to take it out. So you come to the doctor and we do something called epilation. We take out the eyelashes that are going inwards. Now, if it's a few eyelashes, we take it out with the forceps, obviously. But if you feel like, or if the doctor feels like there's extensive eyelashes turn inwards and they keep coming back, then there is a treatment where I have done laser removal also. So I have an instrument. Normally I use the Elman unit, and I have that, the Elman unit that I use to remove the papilloma and the lumps and bumps from the eyelid area. The same device has another attachment on it where that can be used to burn the eyelash growth from the area where they are coming out from. Okay, so that is something that I've done in the past also, and I would highly recommend that because that lasts for a longer time. So far we have discussed myokymia, twitching of the eyelid, subconjunctival hemorrhage, and trichiasis, ingrown eyelashes. And now we're going to talk about TBI. Because I see VA patients also, I see elderly VA patients, so they a lot of times come with history of traumatic brain injury, which is also known as TBI. So when the patients come in with TBI, remember I always mention this, the eyes are connected to the brain because of the optic nerve being the direct continuation of the brain, the second cranial nerve coming out of the brain along with the other 12, the 12 pairs of cranial nerves. So TBI, if it happens, then obviously you have to go to a neurologist, you have to get your MRI, brain scans done, CT scans done, and all of that. But also remember the eyes can also be affected. So if there's a TBI, definitely make sure there is the brain scans are done, they are looking good, and then also look at the cranial nerves, obviously, because that can be affected also. And again, the cranial nerves that are affecting the eye, so definitely look at the EOMs, the movement of the eye muscles when you're doing the eye exam. That's when the doctor can figure out, oh, there's some problem with the sixth cranial nerve palsy, maybe third cranial nerve or the fourth cranial nerve. And maybe one day I will make a video on these cranial nerve palsies and complications that can happen due to TBI. But regardless, when there's a TBI condition, you have to get the brain scans done, get your eyes checked also, and make sure you do not have some kind of traumatic cataract, traumatic glaucoma, or optic nerve complications, maybe retinal conditions such as retinal tears, breaks, holes, or detachments happening on a deeper level. So definitely look into those things as well. And another question that my patients come up with is, what do we do when we're driving at nighttime? These days, some people are driving these cars with really, really bright white lights that are literally blinding sometimes, especially if you're driving at nighttime on a highway. It gets really dangerous. So first rule of thumb, try to avoid driving at night. I try my best not to drive at night, especially if I'm on the highway, because I do travel to go see my family. In the daytime is obviously easier because you can, see better. Your vision obviously is a little bit better in daytime versus nighttime. In daytime, definitely wear sunglasses, as I've always mentioned and recommended. But at nighttime, there's special tinted glasses that can be made to block those the glare and the halo effect. Not halo as much, but definitely the glare and the brightness that comes from these car headlights. These are amber tinted special glasses. There's a company who made it for me, and that has changed my life. Like literally, it's a life changer. It blocks all that annoying glare from other car headlights. If you cannot get the amber tinted glasses, then you can talk to your doctor. Maybe they can make them in your office. It has to be a darker colored glasses. The reason I'm mentioning amber tinted glasses is because of personal experience. A company made it for me, and my life has changed significantly, like I said. So that's one thing to do for nighttime. Or also you can get anti-glare coating on your glasses, because that can help too. But I'm just letting you know about the amber tinted glasses because that's something a little unusual. A lot of patients have not heard about it, so they asked me to mention that in the video. And then these patients who come in with eye fatigue and eye strain, because a lot of us are, I think pretty much everyone who is in the workforce is working on the computer at some point, whether it's a desktop or a laptop or iPhone, iPads. We are all looking at these devices all day long. So I have mentioned this briefly in one of my videos on dry eyes, I believe, but it's called 20/20 rule. So you have to relax your eyes. You have to give your eyes a break. Just like we do physical exercise and we lift weights, or we are doing Pilates, or we are doing planks, we're using our muscles, or we're on a treadmill or elliptical, whatever device that we're using for our health and fitness, our muscles get tired and fatigued, and therefore we take a break. We rest our body, right? Just like that, the eyes have muscles also. And when you are focusing or you're working on a computer for an extensive period of time, your eyes need to relax also. They need a break. And that is known as the 20/20 rule. So what do? You work on a computer for 20 minutes, then you take a break and you look at a target at 20 feet. So that means far away target, and you blink for 20 seconds. And you have to do that every time you're working on these devices, for instance, your computer at work, your desktop or your laptop, and you will notice your eyes are feeling better. They feel less tired and less fatigued. Every time you blink, if you recall from one of my videos on dry eyes, you get more tear production in your eyes because of the squeezing effect from the lids, and the meibomian glands get squeezed also, which are under the lids, and they make more secretion, the oily secretion that keeps our eyes lubricated also, and our tears are made also. So that means that our eyes are going to feel more lubricated with the tears, with our natural tears, and that's going to cause better vision. That's going to cause less stress on the eyes, less fatigue, and your focusing will get better, especially towards the end of the day. Focusing gets really out of control. Your eyes get tired, fatigued, like around, for me, I can tell you around 3:30 p.m. If I start my clinic at 9 a.m., around 3:30, even if I take a 1-hour lunch break, my eyes are tired and exhausted. So drink water, obviously, to keep yourself hydrated. You can use eye drops occasionally, but I don't recommend using eye drops like not every single day. If you don't have to, if it's not a necessity, you don't have to put extra things in your eyes. Your natural tears can be produced also a lot of times. So 20/20 rule, adopt that. You will notice your eyes will feel more lubricated and your eyes are going to feel less fatigued and tired. And if you need some reading glasses, sure, go ahead and do that. But remember the 20/20 rule. So work on the computer 20 minutes, look at a target far away at 20 feet and blink for 20 seconds. Then we're going to talk about ptosis versus dermatochalasis. So ptosis is where a lid is droopy. And this is something that a lot of people can relate to because in this day and age of aesthetics, everyone is into aesthetics. Everyone wants to look younger. Anti-aging creams and devices and technology and fillers and Botox and whatnot. But for ptosis, if it's naturally happening as we grow older, our eyelids are not going to be the way they looked before in our youth. When we were younger. So that's something that's a given. Everyone has to go through those physiological changes in life. So if you notice ptosis, which will be drooping of the eyelid because of the aging process, that is something that can be helped by an oculoplastic surgeon. So yes, there is. I remember when I was doing my internship in Boston, there was an amazing oculoplastic surgeon at Tufts Medical School, and she was working just doing phenomenal job there. I would sit with her and she would specially ask me to come sit with her, and she would show me the technique with which she was doing the lid repair. So that can be done, obviously. And dermatochalasis is something different where you see that in elderly patients where their lid is also, it's not just the lid, but it's the muscles around the lid that are also, the skin is also sagging. So that would be dermatochalasis. But for ptosis, remember, it's the lid. A lot of times it's the upper lid that is droopy. It could happen in one eye versus both eyes. And also I have to mention this because my patients have asked me in the past, is it covered? Is the surgery for ptosis where we do the lid tuck basically, is it covered by insurance? Well, if it is a medical necessity, then yes, it will be covered by your insurance depending on what insurance you have. But if it's not a medical necessity and if it's only cosmetic, if it's done for cosmetic purposes, then of course the insurance is not going to cover that, and then you have to ask your provider how much it's going to cost you. But if it is a medical necessity, then there's one test that I do, which is a visual field test, just like the visual field test that we do for glaucoma patients, where you sit at this machine and you have that clicking thing in your hands and you look at the flashes of lights in the periphery. You don't look at the flashes of lights. Actually, you look at a target in the center of the machine, and anytime you see flashes of lights in the periphery, you do the clicking. You click on that device that is handheld. The same technique can be used to figure out if you're a good candidate for the ptosis repair, because if I see and notice in the results of your visual field that you have a lot of loss happening in the superior part, that can lead to complications when driving. That can lead to, God forbid, car accidents because you cannot see the street signs or the road signs because this lid ptosis or drooping of the lid is restricting you from seeing here in the upper part. Especially when you're driving, you cannot see the road signs and street signs, like I said. So then yes, it becomes a medical necessity. And like I said, as a doctor, I decide that for my patients, whether it's a medical necessity and the insurance can cover it. But if your visual field comes out really good, there's no complication, you're seeing pretty good, you clicked every time there was flashes of lights here in the superior part also, then yes, that would be considered a cosmetic lid repair. Okay, so those are the things I could remember today at least, and they were at the back of my mind because my patients have been asking me to make these videos and asked me to mention these conditions briefly, obviously. We're not going too much into other conditions today because I feel like sometimes the videos get too long. And then, you know, the focusing gets depleted at some point for all of us. So yes, I think this is going to work at this point. But in the future, you know, I can always make more videos. I can make short reels or videos so that at least patients are understanding the conditions. And again, thank you everyone for watching. If you have any ideas, if you have a particular topic you want me to talk about, you can email me. I was going to say email. Just mention it in the comment section. And for the patients, obviously, that I see in the clinic, you can always let me know in the clinic. All right, guys, you enjoy your evening. Take care. Bye.